what is it or how much or what all can I do together at one time? And I think each surgeon has their different parameters. And so in my practice, generally how I determine or recommend what we can perform at one time has to be based on a variety of different factors. The first one, which is the most important, is really the health of the patient. So, if you have a younger patient who has almost no other health issues, no cardiac or heart issues, no lung problems, overall is really relatively healthy except for a substantial history of weight loss, that will give us the opportunity to do more surgery at one time. The second thing I look at in particular is really how long the combination of procedures are going to take. So in my practice, generally if a surgery is going to take more than 6 hours, I really am going to advocate that we try to divide or cut that into 2 separate operations just based on the length of the surgery. We can go longer than 6 hours, but that will usually necessitate an overnight stay at the surgery center, which we try to avoid if at all possible. The third thing has a lot to do with what I feel goes well together from a recovery perspective. So for example, if we were to perform the legs and the tummy simultaneously, the recovery for that is a lot more involved, which is actually what we ended up doing with this patient. But I definitely wouldn't, even though that surgery takes less than 6 hours, I definitely wouldn't add other operations onto it. And so essentially what I'm saying is certain operations do really well, the recovery is very minimal. I try to advocate for not adding the most complicated or intensive recovery procedures to be done simultaneously. So in this patient, this is an individual who's lost a lot of weight. She had previously placed saline implants above the muscle about 20 years ago. There are 500 cc implants. She's very unhappy with the size of the breasts. And so my recommendation for her was actually a constellation of different procedures. At the end, if I was to name the list of surgeries, it was implant removal with a breast lift, an L-type brachioplasty to help remove some of the skin from the arm and then on the lateral chest. In addition to that, I recommended that we perform a bra line back lift, as well as a body lift with an auto augmentation and a thigh lift. So a variety of surgeries, and how we broke that up for her is we did the L-type brachioplasty with the implant removal and breast lift and the bra line back lift simultaneously, so worked on everything on the upper body. And then the second surgery, which in this case was actually performed about 6 to 8 to 3 months after her original operation, was to do a circumferential tummy tuck with an auto augmentation of the buttocks in addition to a thigh lift or a full thigh lift. So I look forward to showing you her after pictures.